Why do we see disproportionate numbers of children from ethnic minority groups in care? Children from certain ethnic minority groups are either much more or much less likely to be involved with children's services than you would expect given their population size. If rates reflected the population, the ethnic profile of a group of children in care would look like this. Relative to the size of each ethnic group's population in England, children from Asian backgrounds are much less likely to be in care than white British children. Black and mixed heritage children are much more likely to be. Poverty is associated with increased rates of intervention. The effect of poverty on care rates is called the social gradient. Mixed heritage, Black and Asian families are much more likely to be living in poverty than white British families. But research has shown that poverty alone is unlikely to explain the overrepresentation of Black and mixed heritage children in the care system. A research team linked information about where a family lives and the level of poverty in their neighborhood to make assumptions about a family's social and financial situation. The research shows that poverty seems to affect different ethnic groups' likelihood of being taken into care in different ways. For white British children, the social gradient shows the likelihood of being in care is 15 times higher if they live in a very poor neighborhood than a very well-off neighborhood. For Black African children, the social gradient is far less steep. A Black African child living in a poor neighborhood is 1.3 times more likely to be taken into care than if they lived in a well-off neighborhood. For Black Caribbean children, the social gradient is different again. They are around 3.5 times more likely to be in care if they live in a poorer neighborhood than if they live in a more affluent neighborhood. This is a much lower social gradient than for white British children, but much steeper than for Black African children. This means that in poor neighborhoods, white British children are overrepresented in care rates. In more well-off neighborhoods, Black African and Black Caribbean children have higher rates of care than a white British child. Different patterns emerge for other ethnic groups and for children of different ages. While poverty is an important factor in understanding why some children are more at risk than others, it is not enough to explain all differences between ethnic groups. Although Asian families are also more likely than white British families to be living in poverty, they are underrepresented in the child welfare system. There is an assumption that this is because of large extended families and support networks in Asian communities. However, this doesn't explain the big differences in the proportions of Indian, Pakistani, and Bangladeshi children in care, and might ignore the diverse experiences of Asian families. In poorer neighborhoods, Pakistani, Indian, and Bangladeshi children are all less likely to be in care than a white British child. However, Pakistani and Bangladeshi children are around 4 times more likely than Indian children to be in care. In a more affluent neighborhood, Bangladeshi children are substantially more likely to be in care than Pakistani or Indian children, and white British children. What does this mean for us as a society? The implications for social justice, creating a fair and equal society, are profound. We need data about individual families and children to understand more about how families' economic circumstances impact on rates of care. We need to work with families and communities from groups, including those with lower intervention rates, to see whether there are positive lessons to be learned. The problem isn't limited to children's social services. We need more research in schools, police, health services, and the family courts to understand if individual or institutional biases are affecting the number of children coming into care. We need better information to understand what strategies might be useful to reduce inequalities. It is more than time for all those involved in or concerned about child welfare to ask serious questions about the practices, policies, and wider social structures which maintain such unjust inequities. Research credits: Child Welfare Inequalities Project, led by Professor Paul Bywaters, University of Huddersfield, funded by the Nuffield Foundation. Nuffield Family Justice Observatory. For more information, visit the link below.